Hello everyone, welcome to my channel. This video is about scope of nursing and categories of nursing. Let's get started with the video. Talking about scope of nursing, nursing responsibilities and duties cover a wide range of functions and responsibilities that depends with the level of qualification and working environment. At the initial level, nurses are required for bedside care of the patient, while at senior level, they are required to manage a special group of people like children, adults, elderly, pregnant women, and newborn. So initially, nurses care for everybody, but when they choose their specialty, they become a specialist for separate care. So first scope can be hospital. In hospital, nurses provide bedside care, they assist the patient in movement, they provide need-based care, holistic care, that is care for body, mind, and soul. That is scope in hospital, scope of nursing in a hospital. In nursing home, same medical care is provided, but the patients stay for a long term in the nursing homes. So nurses provide a long-term care. So their physical, psychological, dietary care and each and every care is needed. Nurses provide each and every kind of care for the patient who are admitted in nursing home. Next is clinic and health department. Clinic provides a specific health service. Nurses provide the same kind of service according to specialty. For example, if that is a maternal clinic, then nurses care for a pregnant woman and after delivery. If that is a pediatric clinic, then nurses care for children, every age group children. Similarly, community healthcare center. Nurses perform home visit and provide care like immunization, family planning, health promotion, and home-based care in community. In old age home, nurses provide preventive, promotive, rehabilitative, and palliative care to old age people. In military, there is a role of nurse in military also. There is a scope of nursing. In military, nurses provide general health care checkup to the military people. Also periodic health assessment, and also if there is any condition, any traumatic condition or any crisis condition, they provide care at that time also. Next is school nurse, very popular nowadays. Every school should have one nurse who periodically examines the children according to age. They also conduct health teaching, health education according to age, like hand washing to schooler age group. Again, dental care to schooler age group. Teaching about menstrual hygiene to teenagers. Again, teaching about reproductive health to teenagers. And nurses also provide first aid care as a school nurse. Next is home health visitor. It is also very popular nowadays. Home health visitor nurse. They work for community, find out a root of the problem that is prevailing in a community through home visit. Personally visiting every family who has sick people and finding out their problem. Is their problem drinking water source or any other part of the environment? Is there problem type of drainage, type of latrine, type of food, or what is the problem? What is the root cause of the problem? Home health visitor finds out that. Nurses, if they work in public health sector medical department, they provide service like health surveillance, vaccination, survey, cleaning up high risk group, and management of epidemic. Whereas nurses scope in training institute is as an educator. Nurses as educator provide education to student nurses. They provide knowledge, develop the skills of the student, and inculcate a professional value towards nursing among students. Nurses as a palliative and hospice care provider, they provide care to end of life people, the people who are at end of their life due to terminal illness. That people can be of any age. who is at the end of the life, nurses provide care to them. They try to fulfill, at least, try to fulfill all of their desires, all of their wants, and make their needs possible as much as they can. Next is ambulatory care centers. These are mobile health service care centers. They can be health camp or other health services. They care for a people belonging to a community who are at risk group, who need the health care at that time. Nurses can also work in health-related industries with the main roles of surveillance and health promotion. Nurses can also provide mental health services by working as a counselor and also a therapist. Through guidance and counseling, nurses provide mental health services to any age people. Parish nursing. This can be a new term for many. Parish nursing means also same thing, counseling, but by using a spiritual method. Okay, so nurses work as a counselor through spiritual method, and they try to heal the patient spiritually. Parish nursing is usually found in church or some other groups, clubs, or some other group of people are there who work as a parish nurse. Home healthcare providers. Home healthcare is basically one nurse caring for one patient. Patient rather being continuously admitted at hospital, they prefer to be taken care at home. So the nurses who are providing home health care make sure that the environment is suitable for the patient, and they also take care of patient's every need like diet, elimination, hobbies, regular medicine, regular follow-up, and each and everything. Next is prison care and de-addiction. Here, nurses provide a rehabilitative care. They help the patient to recover from their condition, and they help them to recover physically as well as psychologically. As a researcher, first of all, nurses find gap in knowledge and practice. They find out that in other parts of the world or other parts of the country, is there same gap? They find it out through researches published about that same problem. They collect that articles, they conduct research at some places where there is problem, where they have found problem, and after conducting research, whatever result they find, they also publish it so that other people, other nurses in that area can read the result and also apply that solution in their work. Next topic is categories of nurses. Categories of nurses includes there are many categories, educational categories and experience-based categories of nurses. Mainly, we learned educationally and we include experience wherever needed. First category is general nursing and midwifery, GNM. Educational qualification for this is +2 passed. Should have qualified the entrance examination which is conducted for general nursing and midwifery. Course duration is 3 years. Next is basic BSc nursing, Bachelor of Science in Nursing. Educational qualification for this is +2 passed in science background. They should have qualified the entrance examination taken by the university, college or any other head institute. Course duration is 4 years. After completing basic BSc nursing, nurse will be able to both GNM and BSc nursing actually. They will be able to provide care in hospital, community, work as a researcher, work as a public health surveillance, can conduct survey, or can provide care at home, at nursing home, can provide palliative care, anything. Basic BSc nursing and general nursing midwifery is a training that makes nurse qualified and able to practice any kind of nursing service. Same thing is for post-basic BSc nursing, but one difference is they are already qualified with GNM and they might already have got license of their state. So, minimum of 1 year experience, preferably in clinical field, is needed for post-basic BSc nursing. but they should have qualified the entrance examination before entering the course. The course duration is 3 years. Next is Masters in Nursing. Educational qualification is a Bachelor of Nursing, Bachelor of Science in Nursing, or Post-Basic Bachelor in Nursing from a recognized university. They need minimum 1 year experience in clinical or educational or any other field related to nursing. They should have qualified the entrance examination for Masters in Nursing conducted by the university or conducted by any other governing body. Course duration for Masters in Nursing is 2 years. After completing Masters in Nursing, nurses will be able to work as a manager, as a principal, as a nursing superintendent of the hospital. There is another course after bachelor called as postgraduate diploma or certificate courses in nursing. Educational qualification for this is Bachelor in Nursing from recognized university. They should have minimum 1 year experience to study PG diploma, and they should have qualified the entrance examination. The course duration is 2 years. They have both clinical and theory related courses, just like any other master's or bachelor courses. After PG diploma also, nurses will be able to work as a manager or officer. MPhil in Nursing, Masters of Philosophy in Nursing. Educational qualification for this is completed Masters in Nursing from a recognized university. There is a percentage requirement for MPhil. Should have obtained at least 60% marks in the Masters of Nursing. Should have experience of at least 3 years depending on the university. Different university have different kind of criteria. In most of the university, there are 3 years of experience criteria. Course duration of Masters in Philosophy is 2 years. Philosophy of Doctorate in Nursing. Educational qualification is Masters or MPhil in Nursing. They should have minimum 5 years of experience, clinical or educational or any other field related to nursing. And also publication, depending on the university. Some university requires 5 publications, some requires 1, but there is a requirement of publication before entering philosophy of doctorate. Course duration is 3 years for regular candidates and 4 years for part-time candidates, PhD in nursing. All the best for your educational qualification and whichever level you are entering. Thank you so much. Next topic will be discussed in next video.